First, before I begin, thank you for the organization, especially thank you to Greg, to Martin, to Aubrey, and to Emma. Second point, thank you for all for having the courage to listen to my broken English. You know, I'm here because I think longevity is important for the society, but also because I want to live at least 200 years so that at the end I can speak English without accent and even understand it correctly. Even with Irish accent, I will be able. Okay, so now let's speak about big data for longevity research. First, data about longevity itself. Yeah, I know you know most of it, but reminder. The first one is about 120,000 people will die of diseases related to old age today, like every day. And it is in European countries about 90% of all deaths are related to aging. In the world, about 70%. And even in the poorest countries, about 50%. So people thinking there are things more important than that. Well, even in the poorest countries, they are wrong. You know that there are three big categories of diseases due to aging. Cardiovascular diseases, there we are progressing quite fast. Cancers, we are progressing fast. And neurodegenerative diseases, we are not progressing. We understand more, but we are not progressing to fight against it. But also, the elephant in the room is that almost all other diseases and almost all causes of death are also related to aging. So, of course, COVID-19, you know that, flu, tuberculosis, but also falls, and even car accidents. The chance that you are dying of a car accident is increasing with age. You know that life expectancy before COVID was rising 2 to 3 months a year since more than 100 years in our countries. But what many people forget is that concerning the maximal lifespan, we are not progressing. Actually, we are about not progressing since more than 2,000 years. So the first person who ever reached 100 years for about sure, it was the widow of Cicero. She died more than 2,000 years ago, and she was 103. And the oldest person ever was probably John Calmore, 122 years. She died already 25 years ago. And the oldest woman today is 118, and the oldest man even less, 113. So what I think, and many of you, I think it is very probably possible to find a treatment against aging within 15 to 30 years, but it will be complicated and expensive, and one of the ways, a big part of the way to reach this is to use big health data. Don't forget that there are sadly reasons to be pessimistic for the next months and even maybe, I hope not, for the next years. So this is the life expectancy during the last about 20 years, and you see the evolution the last 2 years. This is the first time since the World War II that life expectancy in the world is decreasing. Okay, the first time was in 2020, the second time was in 2021. It never happened before since 1945. So there are also reasons to be optimistic. So we learn to work online, we are more interconnected than ever, and psychologically important, life have never been so precious culturally, especially concerning old people. If COVID-19 was to happen just 20 years ago, probably we would just have to accept to have, 30, 40, 50 million deaths of diseases related to old age. And of course, scientific research was progressing a lot. Now, the subject itself, beginning with facts about big data for health. Where is the information? The information is in the scientific literature, in your smartphone, and also owned by the tech giants, and for the biggest part, in the administrations, the medical institutions, medical doctors, hospitals, and so on. It has been said that 30% of big data is health big data, but about 0% probably 0.001% of big data is shared held big data, or at least shared big held data shared with most scientists. I will not speak today a lot about scientific literature, except to say that for me it is absolutely fascinating and depressing that artificial intelligence, big data, is working so beautifully fast for many things, except for studying medical progress, for especially longevity. So like I said, zero public space to share, for example, health data for all. If you know about one app where it is really possible and easy and legal to share your health data, tell me. And there are about, well, no, it's more than that, probably 500,000 healthcare apps in the world. One of the biggest problems concerning health data is the problem called trash in, trash out. It's enough to have a little bit of bad data to spoil everything. So problem of veracity and curation of data. And why? The first big reason is that companies, organizations are working against each other with commercial software, never the same for the different companies. And the two biggest problem is all questions related to, let's say, privacy, where you have the choice between anonymization and pseudonymization. If you use anonymization, it is better for privacy, but it's less good for scientific progress, because, and also it's less good for the person giving the information, because it means that if it is working, the anonymization, once you find something concerning a new disease, you cannot contact the person who gave the information. Pseudonymization is supposed to be a little bit better for sharing data, but of course, anonymization is just in place of a name, you have a number, for example. Of course, it means that you can go back to the person, but it is less good for privacy. Okay, we have enough health data in the world. This is the central message that I want to say here. We have enough health data in the world. What we don't have enough is shared health data. So we have enough health data to know which clinical test should be started immediately, to know which existing drugs have very probably positive longevity effects and also very probably negative longevity effects. It's even maybe more complicated to have the data concerning, it's even more complicated probably to share the health data concerning longevity, negative longevity effects, because of course, companies selling these products, they are not very enthusiastic to stop selling them. I will speak about the big data situation in Europe for two reasons. First, because I come from there, and second, because I think it's the most promising domain. So there is a beautiful communication made by the Commission to the European Parliament, and it's written that by 2025, citizens from all the member states should be able to share their health data with healthcare providers and authorities of their choice. This is beautiful because it means normally, theoretically, if you read it correctly, that you are able to share that you should be able to share your health data with healthcare authorities, but also with scientists. Scientists working in organizations, official organizations. Now you have the theory and you have the practical aspects. For example, my country, Belgium, there is a great site with quite a lot of health data in general called Sensano. There is also for normally each citizen one place called My Health, where you can find all your files, all your health data. So this is beautiful in theory, and now we are coming to what's going on practically. So this is my health files, because I had a chance to have Heart, in fact, a few years ago, so I can consult that. And you see on the right side, toegang niet geopend door het ziekenhuis for all possibilities, so it means access not established by the hospital, and I can tell you that in the most cases, this is the real situation. Well, it's going a little bit better, but still, you cannot share it, but you cannot even access your own health data. In France, there is a beautiful website called Health Data Hub. The principle is, once again, beautiful. We ensure easy, unified, transparent, and secure access to health data to improve the quality of care and support for patients. So, and also, it's also in the text for science, for progress of science. Now, what's happening practically? First, it's very, very, very complicated. You need 3 authorizations to have real access, the scientists to have real access. A few months ago, there were, I think, about 500 groups of scientists asking for information and 8 having real access to information. But there is something more. In France, when you are going to a pharmacy, in about 50% of the cases, you are actually, without knowing it, giving the information to a big American company called IQVIA. This is one of the biggest companies using health data, and this private American company is selling your health data to other organizations. So on one side, you have the principle that health data is shared with scientists and so on, but nothing happens. And on the other side, you have health data sold and not available for all scientists. In Finland, the situation is supposed to be really good. There is an organization called FinData with one important principle called opting out. So it means that people can access, it means that people give access to their data, except if they refuse. And since in Finland people are quite positive concerning sharing science, there is almost nobody refusing. So access has to be paid by the scientists, but it's not expensive. So everything is theoretically great. The less positive aspect is that, as far as I know, but if you know, let me know, this data is not used a lot, and especially, as far as I know, not for nothing concerning longevity. Okay, now, the legal and de facto situation in most of the countries of the world, so can be summarized, or probably all countries. You are not free to share or not to share. You are obliged to share with private companies and public entities. Well, if you have an accident or if you are going to the doctor, you are sometimes theoretically you can ask, you can say I don't want to share my data, but practically it's impossible. And these institutions will sell the data very often, even public institutions, or make it or make it available only with many restrictions. You are not allowed to share most of your data for science. So in no country you are allowed to be legally sole owner of your data. And in fact, you are not allowed to share with scientists. Even, let's say, you do it anyway, you don't care. Scientists will have problems if they use your data. And let's say the scientists don't care. They use your data, they will have problems to have a publication. So almost impossible. What can we do for a few possible open solutions? First, your health data is something sensitive, but there is kind of an exaggeration. It's less sensitive than your political life, it's less sensitive than your sex life, it's less sensitive than much of your private life, and it would be less risky if or when, because the health system is public and when health data are not to be sold. So, for example, in my country, Belgium, most of the health system is public, and as far as I know, there were never really big problems with people using health data for unlawful goals. I think, but I know it's not the point of view of many people here, but I think that we should have a system of patent left, so no patent for longevity should be a general principle, at least for work made with public money. Even if in the capitalist country, like in a perfect capitalist country in some aspects, the United States, federal civil servants using public money, they are not allowed to have patents, they are not allowed to have private company for their work as a civil servant. I think it should be the same for public money everywhere. To facilitate sharing of data, of course, to facilitate, and that is even, once again, more important maybe, the publication of negative results. You know, certainly a lot of you know a few examples of tests who were negative and who were not published. So because of the fact that nobody has to win if it is for private interest. And also for the research outside patentable fields. I know that somebody was saying today that you can find patents everywhere for almost everything. Well, I hope it's not true, and it's not so, well, for example, with metformin, okay, let's say it would be very difficult to patent, and that's maybe for that there is still no team study really going on. We should constantly remind that most people are willing to share health data for scientific and medical goals. They are afraid to share health data to sell it and so on, but for example, there was a poll in Belgium, it was 86% of the people were, 96% of the people were in favor of sharing for scientific and medical goals. And constantly remind that the GDPR, the General Data Protection Regulation, and similar laws in other countries, they are not above fundamental human rights. They must be compatible with them. So when you have a contradiction between specific rules and general interest for health, you are not obliged to follow all crazy aspects. We could share our health data with private organizations, like I'm a member of the board of the International Longevity Alliance. There is also an organization called openlongevity.org. I will come back to this organization just at the end. You should share with for profit companies who are really ready to share health data, but be careful of nice words like open sharing. Very often it's called, there is open in the title, but not open in the practical aspects. Theoretically, we could use the WHO, World Health Organization. It would be the perfect place at the world level to share health data. Sadly, there is no project for this, but there is a beautiful project for support for sharing data at the European level. It is called European Health Data Space. I show first a sentence a few minutes ago, but here this is really concrete. There is a proposal for a regulation just a few months ago with, among other things, 4 principles: interconnectivity of databases, altruist databases. This means that the people managing the data have to be, the organizations have to be working without a for-profit goal. No possible use for commercial goal, that's a complement of this. And of course can be shared with scientists. There are also new collective ways of sharing data. Honestly, I prefer the first one, but just to remind, there is this idea of creating synthetic data, and you don't need, then you don't have problems of privacy. There is an organization called Solid. It's a kind of virtual place where you can share all your data the way that you want. And there are all aspects around federated learning that I never understood, but that are supposed to make it possible to put data together without accessing the data and to go further for progressing for scientific aspects. Some people will explain a lot better this. Of course, we should use artificial intelligence for all of this. There is a fascinating site that we have beautiful progress for many aspects of artificial intelligence. in many, many domains. We have progress with companies like DeepMind and Encyclical Medicine. When you use Google or DeepL Translate, it will even correct your mistakes. But the best AI in the world, for example, IBM Watson for Health, is still unable to considerably enhance your health, and is still unable to really find good information online. This is kind of a mystery for me. 100 billion questions. Why is there no AI really working for progress for progress for medical research? Sorry. Conclusion: we need reliable, shared big health data. Once again, we don't need big health data, we have it. Fast clinical tests, more research, sense of urgency. Today I was listening to many people saying there are millions of euros coming, but why are they not really coming today for the TAME study, for example, or other sense of urgency, use of AI? What we propose is to create a system trusted by citizens, managed by a public institution or a non-profit organization, where by default, opt-out, all health data, anonymized or pseudonyms, can be used for scientific research and not for any other use. Of course, to start a clinical test to enable everybody wishing it to live a radically longer and healthier life. And last thing, what can you do? What can you do? You can share your health big data. No. It's possible in many cases. Well, I know that there are laws, but I know also that you can also always find lawyers to say the contrary of other lawyers. I will not go in details, except to say, if you contact a lawyer, ask him, how much is it going to cost if somebody wants to sue me? It's so complicated that, okay. And why share your health big data? Also because it is not your health big data. It's big health data coming from other people, coming from citizens who want to share it. Okay, that's it. You can, these are the organizations, and of course with many people working in the same direction. You can subscribe to the newsletter, The Death of the Dead. It's free for the first 2 centuries. You can write to me, especially if you disagree, but even if you agree. Thank you.